Hi viewers and my dear students, good morning to everyone. Hope you all are fine and healthy. So you are all welcome in our channel rgcsk.edu. So we will start with our live section today. May you all know about the topic. It is one of an important disease condition that we will study in the midwifery and obstetrical nursing. This section will be very well benefit for all the nursing students of ANM, GNM, BSc, Post-Basic and MSc. So the important topic is anemia. So today we will discuss about what is anemia in pregnancy, what are the classification of anemia, what are the different types of anemia during pregnancy. Among that, today in our live section, we will discuss about the commonest one is iron deficiency anemia. So what is meant by iron deficiency anemia? What are the causes of iron deficiency anemia? What are the signs and symptoms of iron deficiency anemia and the investigation and management, and at the end we will discuss about what is the nurse's role in prevention of anemia. Let us move to our section. The condition is anemia in pregnancy. First we will discuss about the introduction of anemia. Anemia, it is one of the major disease condition that happen during pregnancy throughout the worldwide. Comparing to the developed country, developing countries are happening more amount of incidence of anemia in pregnancy. And directly or indirectly, the anemia will affect the maternal morbidity and mortality rate. And the perinatal morbidity also increased due to pregnant status anemic conditions. So as a result, we are the nurses, we should be aware about what is anemia and what are the different types of anemia in pregnancy and what are the commonest anemic classification in pregnancy and how we have to take care of anemic women during pregnant time in each trimester, and how we have to recognize the signs and symptoms, and how we have to know about what are the investigation and what is the management, and how we can prevent the anemia during pregnancy, because this anemic status directly affects so many complications for the pregnant mother during the pregnancy, during the childbirth and during the postnatal period. Even maternal death can happen during 30 to 32 weeks of gestation due to cardiac failure. So nowadays, we are having a good antenatal screening and checkup. When we are doing a proper antenatal screening and checkup, we have to see what is the hemoglobin status of the women and what is the pre-pregnant hemoglobin status. So when we are screening out, we can give a prompt management during the pregnancy time throughout the trimesters, and somewhat we can manage the complications. If the anemic woman having some other associated disease condition, her situations will be very much pathetic and life-threatening throughout the pregnancy. So let us see what is the definition of anemia. Anemia, it is one of the hematological disorder. Here, the oxygen carrying capacity of the RBC will be reduced. The hemoglobin percentage and the RBC count will be reduced, and the oxygen supply to all the tissues of the body of pregnant women is affected. As a result, she have the different symptoms of fatigueness, dizziness and breathlessness, and even the condition can be worsened as a life-threatening or cardiac failure can be happen for the women. So anemia says it is one of a hematological disorder. Here, the oxygen carrying capacity of the living tissues will be affected. So in the pregnancy, as we can tell, the peripheral smear examination, when the hemoglobin percentage is less than 11 gram percentage, and when the tissues, when we are seeing on the microscope, if they are having the microcytic and hypochromic condition, then we can tell it is an iron deficiency anemic status. So generally in a pregnant status, when we can tell us when the woman hemoglobin percentage is less than 11 gram percentage during the pregnancy, then the woman says as anemic. Thus this was given by WHO. According to their percentage, we can divide it as mild anemia, moderate anemia, and severe anemia. During the pregnancy, the demand of iron is increased due to the growth and development of the fetus and development of the placenta, and excess demand of the plasma blood volume for the pregnant women. As a result, there is an increased demand of iron during pregnancy. Let us discuss general classification of anemia in pregnancy. Anemia can be classified into two types. One is physiological anemia, another one is pathological anemia. So the word itself, you can understand what is physiological, and another one is pathological. Physiological anemia, due to the physiological changes during pregnancy, the demand of the iron is increased during pregnancy. As a result, the woman can have physiological type of anemia. The plasma volume level is increased 40 to 50%, and the RBC count also will be increased. So the women body is needed more amount of hemoglobin, that is essential for supplying throughout the body, and the demand will be extra need of demand is essential in the second half of pregnancy due to the growth of the fetus and due to the growth of the placenta. So all the body, they need more amount of oxygen for the supply. As a result, the women will have physiological anemia. That is a physiological adaptation that happened during pregnancy. That doesn't harm to the women. If the women have a balanced diet and pre-pregnant storage of iron is good in her body, she doesn't have the status of anemic. So the physiological changes will make her balanced to prevent anemia in her pregnancy status. That is about the physiological anemia. The next one is pathological anemia. So some reason behind to go with pathological anemia, maybe of deficiency of some vitamins, or maybe of hemorrhagic situation or other associated illness, the woman can get pathological type of anemia. This pathological anemia has to be taken very seriously, and this has to be early identified and treatment has to be given. Otherwise, the women can go with increased morbidity and mortality in any time during the pregnancy or during the postpartum period itself. So pathological anemia can be classified. First one is deficiency type of anemia. In the deficiency type of anemia, commonest 70 to 80% of pregnancy women, we can see iron deficiency anemia. Iron deficiency anemia, it is the commonest type of anemic status that happen during pregnancy. Iron, it is an element that is essential for hemoglobin, for the oxygen carrying capacity, and it has to be supplied throughout the tissues. When the iron demand is less in the body of pregnant women, the woman can go with iron deficiency anemia. Another one is folic acid deficiency anemia, and vitamin B12 deficiency and protein deficiency anemia. So these are the different type of deficiency anemia. So iron deficiency anemia, folic acid deficiency anemia, then vitamin B12 deficiency anemia, protein deficiency anemia. These are the deficiency anemia commonest we can see during pregnancy. Second one is hemorrhagic type of anemia. Hemorrhagic means blood loss. During the pregnancy, the women have any blood loss. Blood loss, we can divide it into two types, acute type of blood loss and chronic type of blood loss. In the acute type of blood loss, during the pregnancy, if she have any disease conditions such as abruptio placenta or placenta previa. Abruptio placenta, it is the premature separation of placenta. Placenta previa, it is the placenta is situated in the lower part of the uterine pole. So in these two placental causes, they can get hemorrhage during pregnancy. Due to hemorrhage, they will have the blood loss and the women have the status of anemic. Next, chronic. Chronic, the major reason for chronic type of blood loss is hookworm infestation. So we know different type of worm infestations are there. Hookworm, it is the commonest one. If the women have the hookworm infestation, they have the problem of hemorrhagic. So this leads to anemic during pregnancy. And other type of bleeding from the hemorrhoids or piles. if she have a medical problem of hemorrhoid piles, she having a bleeding or chronic peptic ulcer disease is there, due to this gastric bleeding is there. So these chronic bleeding also can affect anemic status during pregnancy. And other type of classifications like thalassemia, sickle cell anemia, hemoglobinopathies, type of diseases like aplastic anemia due to hereditary causes. So these leads to anemic status during pregnancy. Another classification is chronic diseases. If the women have any chronic kidney diseases or chronic liver diseases, that women are high risk or prone for getting anemia during pregnancies. Another classification like infectious diseases during pregnancy. Infectious diseases already pre-pregnant state or during pregnancy, if they have the infections of malaria, if they have the infections of tuberculosis, or the women have Kala-Azar infection or any other type of infections, and UTI, urinary tract infection, commonest one. So these problems are high risk for getting anemia condition during pregnancies. So these are the major classifications of anemia, general type of anemia. So anemia in pregnancy can be divided into two. First one is physiological anemia, that doesn't have any problem for the women because excess demand of iron is needed during the pregnancy. Excess demand of plasma volume is there, excess RBC is there. So these all why needed means because the growth of the fetus and the growth of the placenta is happening during the pregnancy. So the circulatory volume will be increased. As a result, the women can happen physiological anemia. After delivery, during the end of postpartum period, this status will be reduced. Second one is pathological. Pathological due to any disease, condition or reasons that can lead to anemia. First, we have discussed about deficiency. Deficiency, iron deficiency anemia, folic acid deficiency anemia, vitamin B12 deficiency anemia, and protein deficiency anemia. Second, we have seen about hemorrhagic type. Hemorrhagic, acute and chronic. In acute, any pregnancy related disease condition like abruption placenta or placenta previa, bleeding disorder. Then second one is chronic. Chronic commonest one is hookworm infestations and bleeding from the piles or peptic ulcers. Then next we have seen hereditary like aplastic anemia. Then next thalassemia. If they are hemolytic anemic status is there, and hemoglobinopathies, and if they have infectious diseases like malaria, tuberculosis, and Kala-Azar, or if they have the urinary tract infections and chronic diseases of kidney diseases or liver diseases. So this is a general type of classification of anemia in pregnancy. So as a nurse, when the woman come to the hospital, we should recognize and identify what is the type of anemia she have. And each anemia, they have the different type of clinical signs and symptoms. So today in our class, we will discuss the commonest one is iron deficiency anemia. So what is meant by iron deficiency anemia? So in developing country like our India, 80% of the pregnancy women, they have iron deficiency anemia. As a result, for the prevention of iron deficiency anemia, all the government setup itself, we are giving iron and folic acid tablet for all the pregnant women. So this will prevent the anemia. So iron deficiency anemia, what it means, there is a decreased amount of iron during the pregnancy that cannot be balanced for the excess demand of iron for the growth of the fetus and for the placenta. As a result, the women will have iron deficiency anemia. Next, we will discuss what are the causes of iron deficiency anemia. The causes of iron deficiency anemia, first one is increased demand of iron during pregnancy. So this I have told in the physiological changes itself. When our pregnant women in the body, they need more amount of iron during pregnancy. The demand will be increased for the growth of the fetus and for the growth of the placenta and for the mother's body itself, for the changes. As a result, more amount of iron is needed during pregnancy. And this will be needed extra in the second half of pregnancy, that is from the second trimester. Second to third trimester, more amount of iron is needed in the pregnancy. So that is the first one, increased demand of iron during pregnancy. So some women cannot be able to store the iron in the body or according to the pre-pregnant status. Second one is diminished intake of iron. When the woman is not taking proper dietary intake of iron, we know different type of non-heme type of iron is there, heme type of iron is there. So if they are not taking properly dietary, vegetarian people or non-vegetarian people, so they can take sources of iron. So for an example, we can tell green leafy vegetables, jaggery, dates, from non-vegetarian liver, meat, okay, egg. So different type of food items, they have different type of different sources of iron. So if they are not taking in a balanced manner, the women can have the anemic status during pregnancy, that is decreased intake of dietary sources of iron. And third one is decreased absorption of iron. So they are taking the iron in their dietary sources but faulty intake of iron. So some absorption of iron mainly taken in the intestine, jejunum and duodenum. So if they are not properly take the iron with the sources, then they will have the diminished absorption of iron. What are the conditions they can? If the women have any dysentery problem is there, if the mother is having any hookworm infestation, if the mother is having any severe malnutrition, if the mother is having any infectious diseases, the properly the iron will not be absorbed from the intestine. And the intestine is essential acidic environment is needed for the absorption of iron. So we will tell whenever the mother is taking iron, if they are taking citric fruit or citric food, like it is present in lemon or orange, that will helpful for the intake or absorption of iron from the intestine. So if suppose some components is there, phylates that is present in the wheat, or tea, if they are taking more amount of tea immediately after the consumption of dietary intake of iron, what happen? The iron absorption will be reduces in their intestine. And some drugs like such as protein pump inhibitor, H2 antagonistics, like protein pump such as omeprazole. So this will reduces the intake of iron from the intestine. So that is the decreased absorption of iron. Any reasons? If they have any infectious disease, if they have any dysentery problem, or like any dietary sources or any medications that will hinder the absorption of iron. So dietary they are taking a proper iron, but absorption of iron is decreased. That is one of the causes for getting iron deficiency anemia. And another such as sometimes if they have any blood loss, hemorrhagic blood loss is there, they can have iron absorption problem can happen, and iron loss can be happen from the body. And metabolic problems, if they have any metabolic problems like infections in the GI tract or peptic ulcer, that will leads to decreased absorption of iron. And the iron can be more excreted through the skin, feces, or the stools, and through the sweat also the iron can be more excreted from the body of the pregnant mother. And another one is pre-pregnant health status. Pre-pregnancy health status. If the pre-pregnancy health status, women having any anemic status, present pregnancy also she can have the anemic status. In the pre-pregnancy status, if she have heavy menstrual bleeding, and if she have any anemia in the pre-conception period, if she have any infectious diseases of malaria, tuberculosis, to that secondary causes she can get the anemic status. And she have like closed pregnancy, repeated pregnancy. Within first child, within 1 year she got second child. So we will usually see the woman during the childbirth she have a loss of iron from her body. The iron has to be stored again. It will take another 2 years in her body to stabilize the iron storage. So again, if she is repeatedly getting pregnancy, the woman body cannot cope up and she can have the anemic state. And if the women have more number of children, gravida is more, 4, 5 children if they are having, there are also more risk for getting anemic. So these are the major pre-pregnant health status of the women. So that will affect the present pregnant status. The next one is extra demand of iron during pregnancy. Some of the condition is there, like during the pregnancy, if she have multiple pregnancy, more than one fetus in the uterine cavity, like twins pregnancy. So the demand of iron will be more for cope up with the extra demand of physiological changes. So this time she need to take more amount of iron. As a result, she can go with anemic status. So these are the major causes for getting iron deficiency anemia. So I hope you have clear about what are the causes of iron deficiency anemia. First, we have discussed about increased demand of iron during pregnancy. Second one is decreased intake of iron from the dietary sources or faulty intake of dietary allowances. And the next one is decreased absorption of iron from the intestine during pregnancy, and decreased metabolism due to any infectious diseases or chronic illness. And next one is pre-pregnant health status of the women and excess demand of iron, such as like if she have any multiple pregnancies or twins pregnancies. Next, we will see about what are the signs and symptoms or clinical manifestation of anemia in pregnancy. Clinical manifestation, generally we can tell or we can divide like mild anemic symptoms, moderate anemic symptoms, and severe anemic symptoms. In the mild anemic symptoms, mild is less than 11 gram percentage. In that much symptoms will not be there for the mother. Second one is moderate anemia, less than 11 to 8 gram percentage. So here in this, the women will have the symptoms of pallor. Pallor, it is one of the symptoms, like we can see in the eyes, we can see in the nail, blenched skin also we can identify. So these are the major pallor, tiredness, fatigue, weakness will be there, extreme difficulty in climbing the steps or doing the day-to-day activities, fatigue. When the women have the fatigue, she cannot enjoy the pregnancy itself. 3rd trimester, if she have the anemic feature, she will have the extreme fatigueness, she will get irritability, and she cannot cope up with the day-to-day activities and doing some day-to-day work. So like that, she will have the fatigueness. And when it go with the severe type of symptoms, she will have breathlessness will be there, she will have palpitations and cardiac murmur, beats will be there, extra beats can be identified in the signs, and we can see anarchicia or edema, generalized edema can be there, or pedal edema can be identified. She can be associated with preeclampsia symptoms also can be seen in anemic status. And another one characteristics is brittleness of nail. Nail will have very much brittleness of the nail, flat nail, and spoon shaped nail will be there, cholincochia. So spoon shaped nail the women will experience if she have the severe type of anemic status. And she will have the dyspepsia, difficulty in interest to take the food will be there, and she have indigestion problem can be happen. And these are the major signs and symptoms the women will have. And we can see the symptoms can be seen in the mouth also. She have stomatitis, tongue infections will be there, and chelosis will be there, angular stomatitis will be there. So some wound or fissures or commissions that can be seen on the lips, angular side of the lips, and tongue can be full paleness, and it can be full inflamed, and infections will be present because due to the deficiency of vitamins. So these are the major signs and symptoms. Sometimes bleeding gums also can be happen. So these are the major signs and symptoms or the features that we can see if the women have anemia during pregnancy. Next, we will see what are the effects or complications of anemia during pregnancy. The effects of anemia can be seen in the pregnant women and for the fetus also. So we can divide during pregnancy, what are the complications in labor or the childbirth, and what are the complications in the puerperium. In the pregnancy, the women have the complications of preterm labor. So before 37 weeks, she can get the labor pain. So that is known as the preterm labor, and she can have the features of preeclampsia. So preeclampsia have increased BP 140 by 90 mmHg, proteinuria with or without edema. So these features can be seen with the anemic status. And sometimes she can have the cardiac failure also if she need more excess demand of iron, or during the second trimesters, during 30 to 32 weeks of gestations, sudden cardiac death also can be happen for the woman. And next, she have severe type of infections, repeated infections, malnutritions, abruptia, placenta, early separation of placenta. So these are the common complications or effect during pregnancy the women can happen. The next one is during labor or the childbirth. During the childbirth, the women more prone for getting perineal tears, or we can go with the forceps application to fasten the second stage of the labor or shorten the second stage of labor, and she can have the feature of uterine rupture, or she can get third stage complication of postpartum hemorrhage. One of the major problem that happens during anemia. So as a nurses, whenever the woman comes to the hospital, pregnant woman, we have to screen the woman what is the hemoglobin percentage. So whether it is a mild, moderate or severe. So if suppose the woman is in moderate or severe, in the childbirth she can have a bleeding. The bleeding or more risk for getting maternal death if the mother is having anemic state. Very well we can manage. If we are identifying earlier, we are treating or we are managing with the iron therapies. During the childbirth, all the problems can be avoided. The next one is puerperium. Puerperium, the women will have complications of puerperal sepsis, subinvolution of uterus. The uterus will not revert back to the pre-pregnant stage, and puerperal thrombosis or through puerperal thromboembolic disorders, and lactation failure. So these are the different types of complications the women can happen during the puerperium. So these are the effects that happen on the pregnancy. Let us see what happens on the fetus. Fetus itself doesn't get any anemia during the intrauterine period. The fetus can go with intrauterine growth retardation, and the fetus can have during the delivery time low birth weight baby, or the baby will be small for dead baby, or fetal distress can be happen. After the delivery time also the baby anemic status will be good, but neonatal period, during the newborn period, the newborn can happen anemia. Why? Because from the breastfeeding also the woman is not supplying proper iron to the newborn, because breastfeeding women doesn't have the iron in the breast milk, and the newborn storage of iron also will be reduces during the first month of after the delivery, during the newborn period. As a result, neonatal anemia can be happen. So these are the major effect of pregnancy and the fetus due to anemia. Next, we'll see what are the investigations. Investigations mainly is very important to rule out if the mother is having anemia. First one is history collection. So in the history collection, we can ask the mother, as a nurses, we can ask the mother whether what is the socio-economic status. So what type of food they are taking, environmental history. So which race they are belonging, which place they are living, whether it is a hilly area or like that. So that histories can be collected. They have any chronic diseases of liver infections or kidney diseases or medical disorders of piles or peptic ulcer, recent any diseases of abruptia or placenta previa, any bleeding disorders is there, mother is having any malnutrition problem is there, so mother having any associated thalassemia, aplastic anemia, or different type of hematological disorder is there, that we can ask from the history collection. And pre-pregnant health status, what is the pre-pregnant anemic, whether woman having any anemic status is there, how the menstrual flow is there, heavy menstrual flow is there, that we can identify how much blood loss from each cycle, or how much loss of iron is there, that we can identify. And we can ask present pregnancy, whether it is a single term pregnancy or multiple pregnancies there. So we need to know what is the need of iron. So these are the history collection. General physical examination. In the physical examination, head to toe physical examination can be identified. Any weight loss is there, mother is very ill, tired, fatigue, weakness is there, general malaise is there, not interested to do the general activities, day-to-day activities, and very difficult to cope up with the pregnancy. She have any palpitation, breathlessness is there, shortness of breath is there, exertional breathing is there. So these all physical examination can be identified. So we can see in the sclera or conjunctiva whether paleness is there, nail bed paleness is there, general paleness, tongue. We can ask the mother to put out the tongue and see paleness is there. So this will identify. And any edema is there, pedal edema is there, general edema is there, or vaginal blanching is there, paleness in the vagina while doing the vaginal examination, that we can identify. And these are the main physical. And nail brittleness is there, any spoon type of nail is there, or flat nail is there, that we can identify. And any indigestion problem is there, any bleeding is there from the vagina or from the rectal area. So these are physical examination we can identify. Next one is investigation. Investigation, main thing we have to go with the blood investigation. In the blood investigation, complete blood count can be analyzed, and we can see the hemoglobin, what is the percentage. If 11 gram percentage or deciliter is there, that is the normal for the pregnancy. If it is less than 11 in the first trimester, in the second trimester if it is 10.5 or 10, or in the third trimester if it is less than 11, then we can see it is the anemia. And we have to see whether it is a mild anemia, moderate anemia, or severe. If it is less than 7 gram percentage, then it is the severe type of anemia, whether it is 5, 4, 3, 4 and all, very difficult for the mother to cope up during pregnancy. So like that we can see the hemoglobin percentage. The next one is RBC count, and we can see what is the peripheral blood smear, how the cell size and what is the color of the cell. Here microcytic will be there, hypochromic will be there. The paleness in the blood cells will be there, color will be less for the blood cells, and the size also will be reduced, so that we can easily identify as a iron deficiency anemia. Normal physiological anemia, normochromic and normocytic features will be there. Like that we can identify whether it is a physiological anemia or whether it is a iron deficiency anemia. And iron binding status will be increased, ferritin level, RBC count will be decreased. So these are the major blood examination we can identify. And next one is blood urea, creatinine level, liver function test can be done, kidney test can be done for the mother. If they have any chronic diseases can be identified. Stool examination. Stool examination, mainly we have to see for the hookworm infestation. Commonest one is hookworm. What is the main reason? They are going in the bare food without any chappals, they are walking on, they are doing some work or walking on the field. The hookworm can be enter in our body, and this can leads to anemia. So stool examination, they can see any occult blood is there or hookworms are there, that we can identify. And another one is urine examination. Urine examination, one of the cause is UTI. So we can identify urinary tract infection is there, any hematuria is there, that we can identify from the urine analysis. And last one is ultrasonography. Ultrasonography, it is the main thing, mainly we will assess for the fetal growth, how the fetal growth is there, whether it is small for gestational age, intrauterine growth retardation is there, that can be confirmed by the ultrasonography. So these are the major investigations. Next we will go to the management. Management, principles of management, mainly we have to see what is the severity of the anemia, any associated complications is there for the mother, what is the degree of the anemia, what is the health status of the mother. So based on that they can give the treatment. First they can start with a dietary modification, whether it is a mild anemic is there, dietary modification. Dietary, we have to advise the mother to take rich source of iron. That is the best thing, avoid any side effects. Other medications can lead to constipations or bloatiness of the abdomen, nausea, vomiting. So dietary intake is very best for the women, cheap and good. That can have a, according to the status of the women, they can take the dietary requirements. So we can see all the green leafy vegetables, spinaches, drumsticks, drum leaves. Okay, so these all have rich source of iron, and this iron can be intaked by the mother on all the nuts, mainly alpicrot. So that type of nuts is more rich in iron sources. And all the fishes, non-vegetarian means fish, meat, liver. So these are rich source of iron. And dates, daily intake of one dates, that can boost up their iron sources. So spinach, green leafy vegetables. So all that is gooseberries. So whatever is rich in iron, they can include in the dietary sources, and that can prevent the higher degree of severity of anemia when the pregnancy is advances. So that we can first advise. Second one is, if the degree is more moderate or severe type of anemia, if it is less than 7 gram percentage, then we can compulsory admit the mother in the hospitalization. Hospitalization, bed rest has to be given. If it is a moderate type, means we can advise the mother first oral intake of iron. Oral intake of iron has to be given. So ferrous sulfate is the good choice of oral intake of iron. According to the doctor prescription, they can take twice a day or thrice a day and intake. So generally in the government, all the pregnant women, 100 milligram of elementary iron will be given, plus 0.5 mg of folic acid will be administered. So this during the disease condition, if ferrous sulfate, 325 milligram of ferrous sulfate can be given along with the elementary iron. So this can be given BD for the women. When the woman is taking iron, some resources will be diminish the absorption of iron, such as calcium tablet, H2 antagonistic, omeprazole, protein pump inhibitor, tea when they are taking more amount of tea. So this type of sources can be avoid when they are taking the iron tablet. So they can change the timing and they can take the calcium tablet. And citrus type of food, vitamin C, sometimes vitamin C also we can administer in order to increases the absorption of iron for the mother. So this is the iron oral intake of iron. Second one is, if the severe is high, if the woman is not taking properly iron tablet, they are having some side effect, bloatiness, vomiting, nausea sensation, not able to take the oral diet, then we can advise the mother go with the iron parental dose of iron therapy. So this is having of IV infusion is there, IM injection is there. IV infusion, the ampule, 2 ml ampule, so 50 milligram of elementary iron, that is iron sucrose or iron dextran. So that can be infused with the normal saline and they can be administered. So weekly they can come to the hospital and they can take the parental administration of iron. So this can be done in order to till the hemoglobin level is increased in their body. And another one is IM injection. IM injection can be taken alternatively according to the gestational week with the prescription of the doctor. And this can be administered Z-track method. When we are putting the iron injection, they can go with the Z-track method. So this parental therapy consists of IM injection of iron, intramuscular and intravenous therapy of iron. So next, if it is a severe type of iron, less than 7 gram percentage, 4 or 5, and the mother is having associated complications, so many symptoms are there, they can doctor can advise for the blood transfusion for the women. Okay, so that they can decide according to the gestational week. So these are the major management. First one is dietary intake. Second one is oral administration of iron. Then next one is parental, consists of IV infusion and IM injection. Next one is blood transfusion. These are the treatment regimen for the iron. So when these treatments are taken and the pregnant woman is somewhat manageable, then she can go with the delivery. During the childbirth, most of the complications can be prevented and maternal death can be prevented. So in India, we need to give more care for the women during pregnancy. So they will be very much careless. One pregnant is there, they delivered, second child, third child, there will be negligence of going with the antenatal care. So next, our part, that is the prevention of anemia. What is the nurse's role? Nurse has to educate the women what is the seriousness of pregnancy. First pregnancy, the women will be very much conscious, they will be happy to take care of themselves and take care of the fetus. Second pregnancy or third pregnancy, they will be much not aware to see the pregnancy or going for the checkup, maybe of their socio-economic status or the home situations, or nobody will be caring much enough to bring the mother to the antenatal clinic. So when they come, very simple investigation, hemoglobin itself, they can identify what is the hemoglobin percentage, what is the type of anemia. We are taking the treatment very first itself, the women can prevent the complications of maternal death and maternal morbidity due to the anemic status. So what are the nurse's role? First one is, nurse has to assess the mother conditions in the hospital or in the community area. She has to see, in some places they will have malaria, or some places they have like tuberculosis. So those people, malaria people, they have to take anti-malarial drug chloroquine. We have to advise tuberculosis, anti-tuberculosis drug, or anemic mother has to take the anemia. And normal, all the pregnant mothers, they have to take the iron and folic acid minimum of 3 months, and after delivery also 3 months they have to continue till the hemoglobin is raises. So this will somewhat prevent. So we as a nurses, when we go to the community area, we have to see which type of communicable or infectious diseases is there, what prevention we can give, what prevention awareness we can give for the community area, or to the hospital when the mothers are coming, what prevention we can advise for the mother. Dietary intake, what are the rich sources of iron for the vegetarian or non-vegetarian. So we can advise the mother to use the iron utensils for cooking. So this also will get iron through the dietary. So that also boosts their iron. So dietary intake of iron in pregnancy is best for the mother to prevent the anemia. And allowances, whatever the government is giving the extra supplement of iron, that is iron folic acid tablet, regularly they can take throughout the pregnancy. That also we can advise the mother. So this iron and folic acid will prevent the anemia during pregnancy. So that is 100 milligram of elementary iron plus 0.5 milligram of folic acid. This will prevent anemia during pregnancy. So this can be give awareness for all the pregnant women, those who are coming to the hospital or to the community area. So next we can advise the mother, don't go for subsequent childbirth. They have to pre-plan, or they can use the family planning measures to prevent the frequent childbirth. And they can adopt the small family norms, so that somewhat they can minimize the anemia in the subsequent pregnancy. And they have to go with a high risk assessment. If the antenatal mother is having previous anemic status, or present multiple pregnancy, preeclampsia condition, or chronic kidney diseases, or chronic liver diseases, or any type of infectious diseases, that mothers are considered as a high risk mothers. And during the high risk, mothers has to be screened as a high risk pregnancy, and high risk protocol management has to be given. Then we can somewhat manage the mother during pregnancy. And what during the labor? As a nurse, during the labor, first stage of labor, we have to closely monitor the mother. We can give oxygen therapy for the mother. We have to assess the fetal heart rate. We have to assess the blood pressure. Any increased blood pressure is there, and we have to see any bleeding through the vagina is there. Next, during the second stage of labor, we have to monitor the mother for any childbirth difficulty, any obstructions of labor is there. And we can deliver the mother to shorten the second stage of the labor. We can use the forceps delivery or the vacuum delivery. And to manage the postpartum hemorrhage, we can give the oxytocin 10 units. This can prevent the postpartum hemorrhage, that comes under active management of labor. And we have to vigilantly monitor to prevent the postpartum hemorrhage. And during the the postnatal period, we can advise the mother to continue 100 days of iron and folic acid supplements till her hemoglobin level is increased, and they can do the follow-up if they have any anemia, and if they have the newborn also neonatal anemia is there, they can do the follow-up. So these are the major role of nurse in prevention of anemia in pregnancy. So we are doing our role in giving an awareness of all the pregnant mother about the anemia. We can minimize the complication during pregnancy. We can minimize the complication during labor, and we can make a healthy child devoid of intrauterine growth retardation or small for dead babies, and neonatal anemia can be prevented. So this we can keep in mind, and we can do our work best in order to prevent the anemia and for the better survival of the pregnant mothers. So today class we have discussed about what is anemia in pregnancy, and we have seen about what are the classification, mainly physiological anemia and pathological anemia. In the classification, we have detailedly discussed about first one, that is iron deficiency anemia. What is the meaning of iron deficiency anemia? What are the causes of iron deficiency anemia? What are the signs and symptoms of iron deficiency anemia? Then we have seen about investigation, management, and nurses' role in prevention of iron deficiency anemia. Hope you have understood the class, and you can very well watch our future online classes from our channel rgcsk.edu. Thank you.